Pregnancy is supposed to be about life, and yet every day 800 women across the globe die from preventable causes related to pregnancy and childbirth. Malawi has one of the poorest indicators of health in developing countries. The maternal mortality ratio is one of the highest in Africa. Currently, the maternal mortality ratio has dropped to about 460 to 100,000 live births, while the fertility rate is at 6 children, according to Malawi Demographic Survey of 2010. Malawi Safe Motherhood Project and Ministry of Health and Population 2004 indicated that the direct causes of maternal mortality in Malawi include complications of abortions, obstructed labor, ruptured uterus, sepsis, and eclampsia. Prevention of maternal deaths is closely linked to women's timely utilization of emergency obstetric care when complications arise. Women's inability to access care has been related to 3 delays: delay in deciding to seek medical care, reaching a health facility, and receiving medical care at a health facility. A combination of 2 or 3 delays is usually responsible for maternal death. But a monster appears to be on the loose, as the nation has a high vacancy rate of medical personnel, especially nurse midwives, who mostly leave their jobs, venturing to some non-government organizations. The effects are exorbitant, as women who rely on government hospitals continue to die due to shortage of proper medical care in these hospitals. Lilongwe, Malawi's capital, is not spared. Veronica Jekapu tells a story of her daughter and grandchild who died simultaneously due to lack of personnel at Malembo Health Center in Lilongwe. With tears, she tells a story of her daughter who never lived to experience the pride of motherhood.
When she got sick, we had nothing to do, as Malembo does not have personnel. We went to a traditional birth attendant. When we arrived there, we found the birth attendant away. She had gone to attend the wedding ceremony. Then I helped her alone. She gave birth to a baby girl. When the birth attendant arrived, she found all done. She discharged us. Then after some time, I saw her body pale. I had to search for some herbs, as I thought she had become anemic. Later, I prepared water for her to bath. She did. I later went outside to do other things. Minutes later, I went to check on her, only to find her body cold.
This is just one of the many stories on maternal deaths that Malembo has. According to the chief in the area, 1 in every 7 women do not live to see their babies, and if they survive, it is the baby that dies. Not to mention of surgical equipment, vacuum extraction machines, and modern sterilization equipment, Malembo Health Center does not have a midwife. The hospital, which is surrounded by 8 villages with a population of over 9,000, does not have a midwife. As such, the hospital ward attendant helps the women in the maternal department. If all fails, the people are referred to Kabudula Health Center, which is over 20 kilometers away, at their own cost, as the hospital does not have an ambulance. If not, they face the consequences.
There have been almost 4 deaths. Others die and leave a child, or others survive while the child dies. We do not have a doctor here. The way things are, we need to be helped as soon as possible. When one is born, we are happy that our nation is growing, but at the rate things are going, we are very much disappointed. My message is that as I'm speaking, I know government will help us.
It appears that the people in the area are now very scared when one becomes pregnant. As such, they've opted to be closer to traditional birth attendants, which were banned by government. For them, that is the only option. The Lilongwe District Health Office publicist Twinta Simvalo says her office is currently liaising with the Ministry of Health to send personnel for community hospitals in Lilongwe, including Malembo.
Yes, we are liaising with the Ministry of Health to have a lot of nurses to these community hospitals. But, it is a national problem. So it is the Ministry of Health which is handling that issue. Because as of now, Lilongwe is indeed having a shortage of nurses. So we are trying to liaise with the ministry to give us more nurses to be waiting in these community hospitals. So if we do not have a nurse in a given hospital or a given clinic, we try to send a relief nurse who is to work for some given months. But with these community midwives, we are trying to improve on the services of maternity.
However, the Ministry of Health, through its spokesperson, Mr. Henry Chimbali, admitted receiving the requests as well as the shortage of the nurses, and indicated that they will only be able to fill the vacancies once students in various nursing schools of the nation graduate, as they currently have no standby personnel to send to the hospitals.
When students graduate, we post them based on the need, in consultation with various departments based on the number of graduates.
This simply means for now, Malembo and other hospitals will continue having maternal deaths as the government cannot post any more nurses. But how can this oversized problem be dealt with? Maziko Matemba is Executive Director of Health and Rights Education Program.
Well, one of the great challenges we should in Malawi, I think, is human source for health. And our ratios, I think, patients to a doctor, I think, is not well. In fact, we have been running a campaign so that we make sure that we have more midwives in our facilities, because we are so aware that I think government, in terms of investment in human source for health, has been a great challenge, which I think that's why we are failing to meet some of the targets and that the University of Malawi is trying to do more in terms of making sure that we have more medical in our facilities. The scaling up of human resource, for example, there be some staff shifting, because as you are aware that I think for Malawi, for this current year, to have enough for midwives, it's not that easy. It's maybe to shift some staff to other personnel. Also maybe there are other ways of making sure that the availability of untrained or maybe unprofessional health workers need to be skilled up so that we can help our pregnant mothers. For example, we have HSS in our communities, because I think HSS are better off because they can be able to be supervised by our facilities. This is another, I think, short-term means. But I think in long term, we need to do more in terms of making sure. Some of the study which we found out, I think what we need to do is making sure that we have more medical personnel training, because we don't have enough trainers in our colleges who are able to train our doctors and nurses and midwives. So that's another way which government need to do in terms of what mid-term and mid and long-term. But in short-term, I think we need to do what we have, and one side is make sure we need to look at the skill gaps which you have, and I'll be able maybe to use what we have in our facilities so that maybe we'll be able to address some of the challenges which I think the country is making the lives of pregnant mothers living in a very sad moment.
As Mr. Matemba has rightly said, only if healthcare personnel are scaled up in Malawi, the country will continue to lose mothers and babies alike. For now, people of Malembo and other areas will have to wait a little longer for them to have a nurse midwife at their hospital. I'm not sure if procreation has to wait as well. Your answer is as good as mine. For ZBS in Lilongwe, this is Sheila Chimpamba.
Our